Thank you. Thank you, everyone, for being here. We'll go ahead and get started. My name is Claudia Lennhoff, and I'm the Executive Director of the Champaign County Health. I will introduce the speakers here in just a moment. We're here because tomorrow night the Champaign County Board will vote on whether or not to sell the Champaign County Nursing Home to the sole bidder in the recent RFP process. The bidder is two companies together, Extended Care Clinical, LLC, and Altitude Health, Incorporated. We are holding this press conference today because of our concern, Champaign County healthcare consumers' concern, that the county has not done its due diligence on the sale of the county nursing home, and because we do not believe that these companies, or any companies owned by William Avi Rothner or his father Eric Rothner, are appropriate buyers for our county nursing home, which is a community health asset. We have done extensive research into the quality of care and operations of the Rothner-owned nursing homes, both in Illinois and in other states. And we will present some of that research to you today and also let you know where you can go to read it for yourself. At a special county board meeting on May 9th, 2018, Avi Rothner told our county board that in terms of operating the county nursing home, we can do it better, meaning his companies could do it better. Because of the county's fiscal crisis, the county desperately wants to believe that the Rothners and their companies are experienced operators with a track record of success. The research tells a different story if one is concerned about quality of care. And I just want to say that we do understand that the county is under tremendous financial pressure. But the county also has responsibility, not just in terms of protecting the financial well-being of the county and its assets, but also in terms of protecting the welfare of county residents. And so that is what has to be balanced in this decision to sell to this particular bidder. Today, you will hear presentations from Ashley Buckley to my right, who will be giving you an overview of some media accounts across multiple states where Rothner family members own nursing homes. Then we will turn to Libeth Rosas, who will present to you research on the IDPH nursing home violations for Rothner-owned homes. I will summarize what the research indicates to us, tell you about a forthcoming report from a national expert, address some of the items in the county's recent report about the sale of the nursing home, and then Adani Sanchez will talk to you about what county residents can do to express their concerns to county board members. And before I turn it over to Ashley, I just want to say that this morning on WDWS, I heard an interview with John Farney, the county treasurer. And at the end of the interview, he said, I'm paraphrasing, but he said something about that the research that had been done and the data that had been presented regarding quality of care concerns about the Rothner-owned nursing homes, that it was old, it was outdated, some of it was more than 10 years old. That is simply incorrect. That is not, there has been research done previously. Our research has focused primarily on the last 10 years and some very recent, and we have tried to make that publicly available and available to the county board as well. Another thing, just real quick before I turn it over again, the county emphasized the importance of the role of state departments of public health and their involvement with the nursing homes. And so Ashley has some information to present about that.
So,
Can we move the microphone? Thank you.
So there have been some actions by the state departments of public health against Rothner-owned homes. Rothner homes and those owned by Rothner companies have been sanctioned by the state departments of public health in Illinois and in Indiana. They have also had Medicare and Medicaid payments suspended, and that is a form of sanctioning. Center for Medicare and Medicaid Services, or CMS, can impose penalties on nursing homes when there is a serious health or fire safety citation, or if the nursing home fails to correct a citation for a long period of time. The actions that Medicare can implement can vary from issuing a fine, denying a payment, assign a temporary manager, or install a state monitor. Nursing home compare only lists penalties that have been imposed in the past 3 years. There are 2 types of penalties on Medicare's nursing home compare. There are fines that can be once per citation or each day until it is corrected. The other is payment denials, which during this, the government stops Medicare and Medicaid payments to the nursing home for new residents until the nursing home corrects the citation. If the nursing home doesn't correct these problems, Medicare ends its agreement with the nursing home, and the nursing home is no longer certified to provide for and be paid for care to people with Medicare and Medicaid residents. With Medicare or Medicaid will be relocated to qualified nursing homes. So just some of the lists that some of the places that we've come up with and we've researched are South Suburban Nursing Home in Homewood, Illinois was denied Medicare and Medicaid payment by the government in 2014. Foothills Nursing Home in Tucson, Arizona was also denied Medicare and Medicaid payments by the government in 2016. Just another example would be Elmwood Care cited 9 times in short period of time for immediate jeopardy for infractions. And it was quoted saying that no other Illinois facility accumulated as many such citations in that time period in 2008-2009. Omnicare, a medical equipment and medication supplier, has also sued Rothner for $28 million in debt, where Rothner had changed ownership of his company to other entities that were owned by Mr. Rothner to avoid repayment. The IDPH, or Illinois Department of Public Health, health officials cited North Lake's failure to maintain its license and the results of a survey that found substandard quality of care and patients in immediate jeopardy at the facility. The health agency also denied an attempt to sell North Lake to an Illinois group that owns 8 nursing homes that are rated poorly by the state and federal agencies. Another example would be Somerset Place Nursing Home in Chicago, which was shut down by the state of Illinois. IDPH has moved to revoke Somerset's license after repeated inspections that found violence, abuse, and mistreatment of its residents. From 2001 to 2009, Rothner nursing homes were fined approximately $835,000, including court costs. So these patterns aren't isolated, they are a pattern. So these incidents, these citations are a pattern that kind of go through Rothner and Altitude Health Services. And it can be shown not only in state but nationwide.
Ashley, before we leave you, can you read the one on the Foothills Nursing Home again?
So the Foothills Nursing Home in Tucson, Arizona was denied Medicare and Medicaid payments by the government in 2016.
The Foothills Nursing Home was formerly a county-owned nursing home by Pima County, Arizona. It used to be called Posada del Sol. It was renamed to Foothills. I believe that the Rothners bought it in 2011 or 2012. And then 4 years later, it's being denied Medicare and Medicaid payments. So what Ashley has presented, and we have information on our website, and we have shared this out, is that there are serious actions that have been taken by multiple departments of public health in different states that have resulted in nursing homes owned by Rothners being shut down, nursing homes owned by Rothners being denied Medicare and Medicaid payments, and as Ashley indicated, those actions are taken when there are serious quality of care violations. But now, shifting the focus to Illinois, I'm going to turn it over to Libeth Rosas, who's going to talk to you about her research with the Illinois Department of Public Health.
Thank you.
Oh, I'm sorry, wait.
Okay, so today I'm going to present you with information from our research into Rothner-owned nursing homes in the state of Illinois where safety violations were reported by the Illinois Department of Public Health. This research has represented about 60 hours of work, and you have a handout that lists the name of the nursing home, and it's listed by year and quarter as well, and it has a brief description of the incident that happened. And then this is the stack of all the violations that we found in the last 10 years. So I'm just gonna review a couple of them, just so you can know what type of, so you can have a sense of what's included in these reports. So the first one is from Grassmere Place, cited on November 1st of 2017. The facility failed to follow a drug test policy and conduct a drug test. They failed to carry physician orders regarding care, medication, and they failed to provide an appointment for a patient with a high-risk pregnancy. They failed to follow CPR policy and standards to provide effective CPR. They failed to provide orders for one resident, and they failed to provide prenatal care for 2 pregnant women. These failures contributed to fetal demise of an unborn child and overdose, resulting in the death of a pregnant resident. It was noted that the failure to provide effective CPR had the potential to affect all 178 residents. CPR was done on a patient who was sitting on a toilet rather than having them on a flat surface. Another one from Champaign Nursing and Rehab, dated July 27, 2017. Facility failed to follow fall prevention policy and failed to supervise and monitor residents. They failed to notify the resident's physician of severe pain followed by the accident. The resident sustained neck fractures due to the lack of supervision. There was also a resident with a fractured humerus who complained about pain for 5 days straight, and the nursing staff failed to let a doctor know. Another resident had a laceration in the back of their head after a fall. The resident also had 7 prior documented falls and was found under the sink with a laceration to the head. Generations at Neighbors, dated October 27, 2017. The facility failed to respond to a patient's medication request. This resulted in the resident experiencing pain, insomnia, and crying. The report states that the woman was alert and began crying when talking about her experiences in the past weekend, as she explained how the facility ran out of her pain medication. The woman explained they ran out of morphine for the 2nd time in a couple of months, and how it has been a nightmare. She explains being up all night and experiencing excruciating pain and depression. Records indicate that the resident's physician was not notified when her morphine supply ran out. And documentation also indicates that there have been multiple times when the dosage of morphine was not given to the resident. Champaign Nursing Rehab again, cited October 18, 2017. The facility failed to follow fall prevention policies and failed to supervise a patient at high risk for falls. This resulted in the resident sustaining lacerations and abrasions to the right forehead and cheekbone. He also had a tear above the right eyebrow and had to go spinal surgery. The resident fell out of the bed and sustained 2 skin tears to the left arm, measuring 5 centimeters and 1 centimeter long. The MRI scan showed that the resident had spinal cord injury at the level of C3, C4, and C5 with unstable fractures to the interior and posterior columns. On October 17, 2017, the neurosurgeon who saw the resident through the ER said the resident had swelling in the neck, spinal cord, and bones, and these were not from old injuries. The neurosurgeon also stated that the resident should have been sent to the hospital after the first fall that happened in the facility. The residents' motor skills were highly affected. Briar Place, August 31st, 2016. There was neglect and failure to observe a resident. The tub room was unsupervised and the resident was found undressed, floating face down in the tub. There was also blood in the water streaming from the mouth and the resident was unresponsive. Blood was also coming out of the resident's nose during compression. The resident was later pronounced dead at the facility. Another resident stated that there was never any locks in the shower and tub rooms at any time during the day. Additionally, the resident states that he has to get his own linens from the linen room because the nurses are always busy, even though he shouldn't. Moreover, he states that the staff has never checked on him when he's bathing. Tri-State Nursing Rehab Center, January 2nd, 2013. There was inadequate observation and review of a resident that has resulted in pressure sores. The failure resulted in worsening scarsal pressure sores and development of new skin tears. Skin measure documentation dated December 4th, 2012 stated the resident had scarsal pressure sore measuring 0.5 centimeter by 0.5 centimeter by 2 centimeters.
Sorry, sacral, lower back.
On December 5th, 2012, between 10 to 2 p.m., the resident was sitting in a reclining chair and was not turned or repositioned or checked for incontinence or changed at all during this time. At 2 p.m., the resident was transferred into their room where a nurse aide removed their brief and it was saturated with urine and full of large, loose stool. The dressings to the sacrum and left buttocks were visibly solid with both moist and dry stool and were falling off the resident's skin. The pressure sore was remeasured and had increased in size. The wound care plan stated to keep the area clean and dry, but it did not mention to reposition for pressure relief or other interventions for care and treatment of ulcers. However, the physician order states to turn and reposition the resident every 2 hours or every shift as needed. Additionally, the resident had a wound to the upper left thigh, but there was no documentation or Brandon assessment done. The nursing aides could not tell whether the wound had appeared or it was getting worse. Hillcrest Nursing Rehab Center, February 2nd, 2017 and March 12, 2012. The facility failed to conduct a comprehensive assessment of a resident, monitor a resident, and have an environment free of hazards. The facility staff found the resident unresponsive with a long coaxial cord wrapped around their neck between their jaws. There were 3 burnt pipes above the bed light fixture in the room. One of them was a glass pipe, and the other 2 were metal-like, a broken TV antenna. The nursing aide stated that her job was to go up and down the hall to document if she saw any abnormal behavior, such as smoking, drinking alcohol, but she never actually went into the rooms to check on the residents. Additionally, one hall monitor said, "My job is not to help with resident care, pass trays, feed, or monitoring smoking. However, many times we have to assist the CNAs if they need it." The round documentation sheet was missing between the hours in which the resident was found with a cord wrapped around his neck. Elmwood Care, September 2nd, 2018. A 50-year-old male on dialysis continuously expressed suicidal thoughts, and a review of psychology and a nurse practitioner stated that he needed a psych consult. Social services expressed the resident making decisions that were not in his best interest and having a hopeless attitude. During an interview with the director of nursing, she stated that the psych consult had not been done because she felt this wasn't an emergent situation, despite the verbal expression of suicidal thoughts from the resident. The resident left a note stating, "I tried to tell you that I didn't want to live any longer." And I just want to conclude by saying that in almost every single case that has led to this problem, it has been because of short staffing in the nursing home. Staff didn't have the capacity to do what they were supposed to do, And this was also frequently stated in the reports where they explain having a lot of residents to take care of and not enough people. And then another common cause of the problem, besides inadequate staffing, was that they were lacking resources. There was one report that mentioned that the gas had been turned off for a couple weeks, and prescriptions were not available. They were running out of medication, and we just want to encourage everyone to take a look at this information. It's available to the public.
Thank you. Thank you, Libeth. These are the printouts. We can't make them available to everybody, but the document that is in your packet that lists the violations, these are under the Illinois Department of Public Health. So these do not include the Medicare violations. That's a whole other set of research, and we just haven't had the capacity to do it. But I would really encourage people to go and read those reports, and especially under the section where it says findings include, and there's a narrative of what happened. There are some innocuous seeming things that don't seem like a big deal. For example, there was one violation where a nursing home was cited because they were using a grill to cook food. And at first, when Libeth first, showed it to me, I assumed that the grill was too close to the building or something like that. But you go in and you read the violation, and it turns out that actually the outdoor grill was indoors in the kitchen in a non-vented area because the gas had been shut off. And without the staff cooking food on the grill, staff were not able to provide hot meals to the residents. So you really have to go in and read and see what is there. And we're making this available for everybody. You don't have to take our word for it. You can click on the links and go in and read the reports. What the research indicates overwhelmingly in terms of the quality of care issues is that owning more nursing homes doesn't mean you do it better or that care is standardized. It doesn't mean that. I think the county wants to believe that a big operator with a lot of nursing homes and a lot of experience in owning nursing homes is going to do it better. The research doesn't bear that out. Yet you would expect a big, somebody who owns a lot of the same type of company, that there would be some better standardization of care, and that you wouldn't expect to see these kinds of issues. You wouldn't expect to see nursing homes shut down or denied Medicare and Medicaid payments. It's very clear also from the reports that when you go in and read them and the staff are interviewed about what happened, overwhelmingly they indicate one way or another that they just don't have the capacity to follow the doctor's orders or to do what is required of them, basically because they are understaffed or they don't have the supplies, they don't have the resources. So anyway, we're making these materials available to you, to the public, and to the county board. And now I want to talk about the county's report. The county issued a report on May 18th, and I just have a brief response. The report was issued in response to concerns that our organization and other organizations and individuals raised regarding the first item that is discussed is in the report is whether the county has done its due diligence and whether the $11 million price will cover all the debts of the county's nursing home. I won't get into the details on it, but you have it in the handout. I have gone to the county board numerous times and advocated for the county before they even tried to sell the nursing home to do what is called a healthcare valuation. That's a very specific term with very specific meaning, and where they should hire an independent party to do that, an independent expert, not somebody who works for a brokerage firm, but somebody who that is all they do. This would be almost equivalent, it would almost be equivalent to if you're trying to sell a house or buy a house, and this is not a house, it's far more complicated, but if you're trying to buy or sell a house, and you want a home inspection, you want to hire somebody who all they do are home inspections. They're not associated with a real estate agent. They have no stake in whether you buy or sell that home. They just come in as an outside independent expert and they do the home inspection and they give you the results. An independent healthcare valuation is sort of the same thing. The county maintains that because they've gotten some financial evaluations from brokerage firms that they have done their due diligence. We disagree, but it's not just us at Champaign County Healthcare Consumers who disagrees. We have contact with a national expert. His name is James Unland, and we can make his resume available online to you, but he is a foremost national expert on healthcare valuations, and he has communicated with the county that what he has seen so far, what was included in the county's report, does not constitute an independent valuation of the nursing home. The issue of whether the $11 million sale price of the nursing home is enough to pay off the debt of the nursing home, we stated that it wasn't enough. That statement came as a result of me serving on the RFP committee that was reviewing the bids for the nursing home. We received a presentation by Van Anderson explaining to us that the $11 million that we could get from this buyer would not be enough to cover all the debts of the nursing home. In addition, Deb Busey on May 7th had emailed me and stated that we do not anticipate the $11 million will be enough to cover all bond payments, outstanding payments to vendors, costs associated with the sale, and repayment of the county's funds of outstanding obligations. Whether the $11 million is enough or not is sort of a technical issue. I just wanted to explain why I made that statement, and that it was based on information provided to us and to the public by the county administrators. We've addressed the quality of care issues. The Medicare star ratings are not enough. You have to get into deeper research, as we have started to do, and we believe that the county has more work to do before they decide to sell to this buyer. The last thing that I wanted to mention, well, two things. An issue has come up regarding the property tax for the nursing home and whether that property tax would be retired once the nursing home is sold or after its debts are paid. The property tax in question was established by voter referendum in 2002, and the language specifically stated for maintaining the county nursing home. I believe that brings in about 1.3 or 1.5 million to the county. I had been told by county administration that that property tax would not sunset, would not be retired. It would continue to be collected even after the nursing home is sold and all its debts were paid, but it would just be delisted from the county's line item statement about the property taxes, and it would just go to support other things. I simply asked a question about whether that's legal. It doesn't seem ethical to me, but I asked about whether it's legal because that property tax was established by voter referendum for the specific purpose of maintaining a county nursing home. The county is now working to get a legal opinion on whether it's okay to continue to levy that property tax. The last thing that I wanted to mention before I turn it over to Adani Sanchez is that tomorrow, the expert who I was talking about, James Unland, will be releasing a report, and he will make it available electronically. I will share it with media. I will share it on our website. I will share it to our listserv. I will share it to the county board. James Unland has been in contact with county board members. He has been reviewing a lot of documents. He's the individual who does not believe that the county has done its due diligence with regard to the nursing home. And he said that, among other things, he is concerned about the level of due diligence given the responsibility, the fiduciary duty to taxpayers. It seems to be a mad rush to do something that could have a very serious, consequences for the county and its people in the future, including the people's health needs. He agrees with people who are calling for a delay by the county board in taking this vote and making this decision. He believes the county has some more work to do and that it would be productive to do so. And he said that this buyer in particular is as concerning as anything else. So he will state that himself and more in the report tomorrow, which I will make available. So now I will turn it over to Adani Sanchez to talk about what county residents can do.
Thank you. I just want to clarify
Move the
that.
mics, please.
Oh, sorry.
Sorry. Thanks, everyone. I do want to talk about what can county residents do. Residents do have a voice in this matter. If there are residents who are concerned with the county's lack of due diligence or apprehensive about selling the nursing home to this particular buyer, we encourage you to let your county board members know how you feel. The members are under tremendous pressure to sell now because of the county's finances, which is exactly why they need to hear from you now. The financial strain is real, and the pressure is very intense, but they need to understand what's at stake. However, rejecting this bid does not exclude the county from working with its brokers to solicit other bids in the near future. So saying no today would not mean saying no tomorrow. Given the concerns that exist about the current bidder for the nursing home and the need for more information, please ask your board members to slow down and not rush into the sale of the nursing home to this buyer. There are other promising developments in progress for the nursing home, and these should be allowed some time to flourish. You can contact your county board members by email or phone before 4 p.m. tomorrow. You can also register your opinion in person, and we encourage everyone, if they are available, register your opinion in person during the public participation section at the county board meeting, which is Thursday, tomorrow at 6:30. That's going to be at the Brookins Center. Let them know that you oppose the sale of the Champaign County Nursing Home to the current proposed buyer, and because of their track record. Champaign County can do better than this, and please encourage your board members to think about their decision on Thursday.
Thank you, Adani. The last thing that I want to say before we open it up to questions from media is that county officials have stated, including in the report that they issued, the people who are opposing the sale have an agenda, and I think that's a fair statement to make. Our agenda, just to be very explicit about it, at Champaign County Healthcare Consumers, is that we are working to protect the health of the community and the assets that belong to the county residents. That doesn't mean that we are saying never sell. But what we are saying is not to this bidder. We do not believe that the county's health, especially for the long term, will be well cared for under this particular bidder the way that it has been for decades under the Champaign County Nursing Home. And part of the county's responsibility in protecting the county is not just to protect the investments that have gone into the Champaign County Nursing Home, but to try to protect and ensure a similar quality of care for the future, for future residents of the nursing home that could include people like me. And that's part of the county's responsibility. So we'll go ahead and close it unless there's any questions from media. If anybody wants to do any interviews, I will make myself available.
You allow questions from non-media?
I will address the media first, and then I can take questions from non-media.
Claudia, you were on the RFP committee.
Mm-hmm.
Did you visit any Rosner facilities, go on any of the tours that some of the members took?
I did, but not as part of the committee. I had the flu when the committee went and visited. I think the committee reported on those visits. I'm trying to see if I can find the names of the ones that I visited. So I did not go on the tour. This was a prearranged tour. So I'm sure, everything was in beautiful condition. I went a couple weeks later, and I ended up visiting 4 nursing homes. One was Beecher, which is one of the ones that our committee members went to see, and that's rated a 5-star nursing home.
What's the name of that home?
Beecher, Beecher.
Is that the name of the home?
Yeah, it's Beecher Manor Nursing and Rehabilitation Center. I also visited Prairie Manor Nursing and Rehab, which is in Chicago Heights. The Beecher one is in Beecher. I also went to South Suburban Rehabilitation Center, which is in Homewood, Illinois. And I went to Tri-State Nursing and Rehab Center, which is in Lansing, Illinois. So this was an unannounced visit, and I'm just, part of the reason, I'm just going to say that I was not impressed at all. I'm cautious about wanting to give like my personal impressions, notes from my visits, which I have. The reason that I'm cautious is because I think that's one person and my impressions could be easily dismissed. I think we have, people want to talk about fact-based information. I think we have that there. I will tell you that I saw a lot of evidence of understaffing. I saw, in one of the facilities, I saw a door to the outside, not the front door, but another door, open, unlocked, with the keys in the door and nobody around. I overheard conversations in 3 of the facilities among staff where they talked about, they just happened to talk about how understaffed they were as I was walking past. I overheard a conversation with a family member. I don't know what had happened to the resident, but where the staff member was explaining to the family why something happened and that they had been understaffed and that they were, trying to assure that it wouldn't happen again. There was one facility where an entire wing smelled very strongly of urine, very strongly. It was repulsive. It wasn't just in front of one room, it was an entire hallway. There was another one where there was a series of 3 rooms in front of a nursing station. There were no nurses there in that particular area, but there was a different kind of smell. I'm not a healthcare professional, but I am aware of what this smells like, and it smelled to me like pressure sores in earlier stages. And I just want to say, part of the reason that people go to nursing homes is because they need help physically. Sometimes they need help turning so that they don't develop pressure sores. They need help getting up to go use the restroom. They need help getting their catheters changed. They need help with feeding and bathing. They need help with getting their medications and things like that. When those issues lead to health problems, pressure sores that go deep into the bone and lead to serious infection and even death, as have been in some of the cases at these homes, that is because staff are not able to keep up with the patients. When people develop serious urinary tract and kidney infections and things like that, a lot of times that is also because staff cannot keep up with the daily needs of the residents. That is why people go to nursing homes. They also go to nursing homes because they have been, a doctor has ordered their care. There are orders for the type of care that is to be delivered. And as we heard from Libeth's recounting of some of the cases, sometimes they're not able to follow the protocol that has been prescribed. And a lot of that has to do with staffing. And that's why I'm so concerned about what will happen to Champaign County Nursing Home.
Claudia, at the times at the nursing homes you visited, since you were not visiting with the group on the formal visits, were you escorted through? Did you announce yourself? Did they know that you were there as part of the Champaign County RFP committee?
Nobody asked me anything.
Nobody asked you anything at the entrance, like, who are you? What can I help you?
Nope, I signed in, I said who I was on the sign-in, but nobody asked me anything.
Okay, so you just walked in, nobody asked if you needed to see anybody. You didn't tell anybody verbally who you were.
No. This is not something that's unusual for me to do. I do it in our nursing homes here in Champaign County. I do it at the Champaign County Nursing Home. I sign in when I go.
So you don't consider that in itself a problem?
No, what is a problem, however, what was surprising to me with these nursing homes, most of the nursing homes that I'm familiar with, usually to enter you have to put in a code, and there might be a message to let the person coming in know what the code is, because a lot of times nursing homes have patients who have memory care, dementia issues, so you usually have to put in a code. I didn't have to put in a code to enter any of these nursing homes. The code was not in effect. There was usually somebody sitting at the desk, but nobody asked me anything. I just went and signed in and walked in and looked around. One of the facilities that I went to, I was on a floor where somebody came up. That floor apparently needed a code. I went up through the elevator. But a person walked into that floor and hadn't put in the code, and the alarm went off probably for about 3 minutes, and nobody came. And the alarm is there to protect the residents. Nobody came. Another family member came in to visit their family member, and they knew how to disable the alarm, but no staff member came. Again, it takes staffing to do that kind of monitoring. But again, I don't want to present what I saw, in a report or anything like that, because I feel like, we need to look at data, we need to look at official reports. The county says that we need to be fact-based. Here are facts, here are documentation of those facts.
Just one last question on it. Did the signs of understaffing that you saw, did you see some of those signs at each of the facilities you visited?
Yes. Yes, I did. At every facility, even the 5-star facility, which was very physically nice. The building was very nice. The building itself was new, was very nice, but there were signs of understaffing. People slumped over in their wheelchairs, in all different kinds of places. And if you read these kinds of reports, that is also a cause for concern. People slumped over in their wheelchairs, depending how bad the slumping is, can lead to problems. It can lead to falls. It can mean the wheelchair isn't alarmed properly, things like that. People can have breathing and digestion obstructed and things like that. And I also saw very little staffing during the meal times as well, which is another concern. Any other questions?
Based on your research, can you give an estimate of how many violations you all have collected, or hundreds or dozens? Or?
Well, we just went we just went back 10 years. We could count them up in the document, and these are only the violations listed under the Illinois Department of Public Health. There's a whole other set of documentation that has to do with Medicare violations, and that research will be very intensive and time consuming, and we haven't gotten to do that part of the research. But I think many of the violations were very recent. Libeth read some, across a span of time, but most of them were within the last 2 to 3 years. So these were very recent violations.
I just want to kind of give an idea, for people, when you give a number, how many are we talking?
I need to stop and look, but
okay. Is it safe to say hundreds? Is that safe, or dozens? Yeah.
Yeah.
Okay.
Just from Medicare the skimming that I did for the Medicare.
Okay.
Ashley started to look at Medicare. We haven't had a chance to compile that yet, but it's a lot. And one of the things that I've heard from the county and from county administrators, and that is in their report, is that you can look at any nursing home and find problems. That is true. It is really hard work, and here you can always find problems. However, what we looked for and what we presented to you today, are not just typical problems. We presented to you information about state departments that made decisions to shut down some of the Rothner nursing homes in Illinois and in Indiana. We also presented to you information about some of the nursing homes where Medicare and Medicaid payments were suspended. That's a result of violations that affect quality of care. So those are pretty extreme actions by the regulatory agencies, and so it's very troubling that we see so much of that. And then the violations reports, which frequently resulted in fines. I think it's also important to understand that, our research focused on the ECC and Altitude Health nursing homes. We also identified other nursing homes owned by William Avi Rothner and Eric Rothner, his father, who are not under those two companies but are located in the state of Illinois, and then others that are, around the country. It's really important for people to understand that nursing home ownership and the companies that own nursing homes, a lot of times are constantly changing. You can find an individual who has a lot of different companies that own nursing homes or different aspects of nursing homes. So our research is not comprehensive by any means. I feel like we are just scratching the surface of Rothner-owned nursing homes, but what we are seeing is very troubling.
Do you know if any of the homes that you looked at, all of this material, are owned by the specific companies?
Yes.
Altitude and Extended, owned or operated by them, by those companies in particular?
Yes. We can, I'll send you the document, but yeah, what we did is we made a list of, this is, for example, extended care. So we made a list of the extended care homes. We identified Altitude homes, and then Van Anderson provided, we had already found these, but Van Anderson also provided other...
Van Anderson is...
assistant county administrator. And he really did a lot of work. I'm not criticizing Van at all. He's tried to do really a lot of work, but he identified other nursing homes owned by Michael Avi Rothner or Eric Rothner. And these two names are important. Avi Rothner.
That's William, right?
Yes, William Avi.
Avi Rothner.
That's correct. And those names are important because this is Avi Rothner, who presented to the county board, and he has ownership in the companies, but also his father. So this is a letter of, it's just, I was going to say a recommendation or support, but it's a letter from a bank, basically, about Eric Rothner, assuring that, he has the capacity to, pay the $11 million. But Eric Rothner and Avi Rothner are frequently involved in companies together or separately, but they work together. Yeah. So we can send you the document. It has a list of the extended care nursing homes.
Maybe the quickest way, if I can just get a quick picture on the phone, that would be
Okay.
one way to get something that I can read.
So this. And then I can email you this document. It has a link to that. Any other questions? Do you all need to do individual interviews or? Good?
The packet that you handed out today, is there a PDF version of that?
Yes.
Where can I find it?
I will send it to you. This document, we are going to be putting it up on our website in a little while. It takes a little while to format it and put it up, but we will hopefully put it up in the next few hours. Go and look at these reports themselves. What I will say is that Champaign County Nursing Home has never been shut down by the Illinois Department of Public Health. It has not had its Medicare and Medicaid payments suspended during any period of time that I'm aware of. Part of the issue is the result of the violations, what happens to people. In these reports, people died, they were maimed, they were harmed, they were disabled as a result of problems that happened in the nursing home. So for us, one of the standards that we're looking at, since the county pointed to the importance of the state departments of public health, we're looking at are the most serious actions by the state departments of public health.
And that's what I'm talking about too.
That includes shutting down nursing homes, and it includes suspending Medicare and Medicaid payments.
And you do.
I am aware of that. That's
I mean,
part
these
of
are all
that.
anecdotal, the ones you're reporting.
No, they're not
And the
anecdotal. They're not anecdotal.
The
They
ones
are
that-
documented violations where state inspectors went in and found these things. What's anecdotal was my report about
No.
what I witnessed.
No, I'm talking anecdotal in that she reported individual ones. I'm talking data that Van reported by the numbers, and the numbers for the Champaign County.
I'm not going to argue with you. I think we disagree on what the word anecdotal means. This is documentation, and again, I encourage people to go and read the reports, not just of what happened, but why it happened. And there's information there. Michael,
one last subject.
No, I'm sorry. I'm gonna take Michael, and then we're gonna stop. And then if you want to talk to me individually afterwards, you can do that. But I'm not gonna hold people here much longer. Michael.
So it seems to me, just from learning about Mr. Ruffner and the way that the Champaign County Nursing Home has been in the public spotlight for a few years, that there's much more scrutiny when a nursing home is community owned, and much more accountability therefore. I know, for instance, some of the folks that work there, they're very upset when things happen, that residents, it doesn't always go perfectly. Occasionally something happens, and while they're sad to see their coworkers get disciplined, they wear it as sort of a badge of pride that there's accountability there, and they serve the residents first and foremost. I've heard a couple of things. For instance, when Mr. Rothner was talking about the way his businesses were set up, and the LLC and his associate said, yes, we set it up that way so that limits the lawsuits. I've heard one of the family members of a resident of Champaign County Nursing Home at another forum expressed concern that he was aware that in some for-profit nursing homes, if you complained about something that happened to your family member, that they would basically evict you or throw you out. Is there then a really big difference in terms of the business model between a publicly owned nursing home and a for-profit nursing home?
There is a very big difference. One of the things that you're correct and that you mentioned is that there's greater transparency and accountability of a publicly owned nursing home. Part of the reason that we talk so much about Champaign County Nursing Home and any problems that it has had is because it is a publicly owned nursing home. But in terms of the business model, the difference is huge. This has been very well documented by national studies. Basically, for-profit nursing homes have to generate a profit. Somebody is making money off of them. It's hard to make money off of a nursing home, especially when you're accepting Medicaid patients. Medicaid is a very bad payer, especially in the state of Illinois. You have to, make sure that you have a good payer mix and all that. However, the reality is that for-profit nursing homes, and especially investor-owned nursing homes and these complicated nursing home arrangements, national studies have shown that the quality of care is worse, the incidents are more serious, the violations are more serious, and that staffing is lower and different. And that's because of trying to make money off of the nursing home operation. And even Mr. Rothner said at that meeting, May 9th, that we're overstaffed at Champaign County Nursing Home. And he indicated that some of the changes that he would make is he would also change the balance of staff. You would have fewer nurses and have more CNAs and other types of staff as opposed to nurses. It's really important for people to understand who can carry out physician orders and what nurses can do versus what other staff members can do. And I think that's part of the reason that we see these kinds of violations and these kinds of stories. And if people think that it's not going to change, I think that is based on some kind of blind faith and hope that research just doesn't bear out. It just doesn't bear it out. Now, every now and then you can have a very excellent for-profit nursing home provider. You can have a county nursing home or a nonprofit nursing. Each individual nursing home can have its share of problems or its excellence and all that. But in the aggregate, when we look at these issues, for-profit nursing homes are very problematic when it comes to, or can be very problematic when it comes to quality of care because of staffing. And one of the things that I think people hope for, and that Rothner and others talked about is, they feel like they can do it better because they can bring economies of scale to their operation. Well, economies of scale are fine when you're talking about purchasing supplies, purchasing food, purchasing medications, and things like that. But economies of scale in companies like this does not mean that they bring more staff. That's not what it means. They save money for themselves on those other costs, supplies, and things like that. But they save money on the staffing side by cutting and restructuring staff. And then that has a direct impact on quality of care. Nursing homes are for nursing care. That is what people need. They're called skilled nursing facilities. People need care. That is the primary service that is being delivered. And when you start cutting staff, you start having problems. So I'm going to wrap up. If anybody wants to have a discussion, you can have it with me. I'm going to release the rest of staff. We'll go ahead and leave this up here. Thank you all.